Hello everyone. This topic is antihypertensives. So what do you think? What do you think when you hear about antihypertensive? These are to treat hypertension, like high BP. This is a very have several cases have seen with the hypertension or high BP. It's very important to control high BP as this can lead to several other diseases. So let's see what are the drugs that we comes under the category of antihypertensives. Again, we are seeing on view of these cardiovascular drugs. Okay, so we are on pharmacology part 1, cardiovascular system, and there is around the fourth section is about antihypertensives. So antihypertensives and cardiovascular drugs. So some of the important categories comes under these antihypertensives. Let's see what are they. Diuretics. Examples are amiloride, furosemide, hydrochlorothiazide. So lots of ides are there. Spironolactone. So diuretics, as you all know, they remove the excess water from the urine by diluting the urine and thereby reducing the blood volume and the blood pressure. Beta blockers, some of the examples are atenolol, labetalol, and metoprolol. They all have these words ending in lol. Okay, and ACE inhibitors like angiotensin converting enzyme inhibitors. So this is differently with different examples are enalapril, lisinopril, ramipril, all those ACE inhibitors ending in prils. Yeah, pril. Angiotensin 2 receptor blockers. So it's very important to inhibit or block those sites that increase these hypertensions. So mainly you can see that all these antihypertensive drugs are inhibitors or blockers, inhibiting compensatory mechanism and all other different things that's happening in the body. So angiotensin 2 receptor blockers, examples are losartan, valsartan. So, in one of the clinical cases, you can see that some of these drugs, like lisinopril, like ACE inhibitors, they have some side effects like cough caused by bradykinin accumulation. So, your doctors might not everyone get the same side effects. So, if you get the side effects, sometimes doctors change to ACE inhibitors to ARB for the hypertension treatment. So remember, as in our first video, there are different aspects for the drug like indication, contraindication, side effects, everything. So you have to see as the patient as a whole, his medical history, how a patient is unique to another one, so and treat accordingly. So treatment is mainly like a balance between the benefits and the risk, yeah, caused by a medication. And alpha blockers are prazosin. Then there is renin inhibitors, alisquirin. So this word, what does it reminds of? Think a mnemonic, because when I read this word, it reminds me like Alice in Wonderland. So make your own mnemonics to remember each drug. Yeah, calcium channel blockers. So these are amyloid, so calcium again some for the muscles contraction, everything. So in this case, as we said, antihypertensives are mainly all the blockers and inhibitors. So calcium channel blockers are amlodipine, diltiazem, verapamil. So these are the main calcium channel blockers. Again, if you hear see dip, like it's like again try to remember dip, like dipping the blood pressure, amlodipine. amlodipine. So it's like individual things. There is also this one amiloride. So there's a spelling difference. Amlodipine and amiloride. These are all antihypertensives. And the categories itself tells us the mechanism of action, how they act, isn't it? So when you study the drug, the most important is mechanism of actions. And the other categories that reduce hypertension or antihypertensive drugs are clonidine, labetalol, alpha-methyl dopa, sodium nitroprusside. So these are all the different categories comes under antihypertensive drug. Thank you and see you later.